Michelle, wonderful to have you on the program. I think the audience that aren't aware of who you are would love to get a quick 60-second intro and background as to who you are.
Absolutely. I wanted to start off by saying thank you all so much for having me. I am so excited to kind of share my experiences and what I do with you all. My name is Michelle Ubah, and I'm the current senior manager of OBGYN here in Northern California, Kaiser Permanente in Vallejo. I have an extensive experience or background in maternal and childcare health. I've been doing this work actually ever since I was 13, 14 years old. And I love sharing my why and how I started in this career because that's exactly what still drives me till this day. My parents immigrated here in 97. And had all of us, my 7 siblings, back to back here in America, originally from Nigeria. And my parents sent me back to Nigeria at the age of 10 because they wanted me to really understand and learn my culture, but also to get to meet my family because we were the only ones in America. So I went back home for about 3 years, and that is where I really got to learn my culture, learn my language. I speak it fluently, and really meet my other family members. And through those conversations, I really got to learn, my background. And one thing that I saw and one thing that I talked about with almost every woman in my family was the challenges that they experienced as it relates to their birth, right? We had a lot of challenges with preterm pregnancies. We had premature births, we had some stillbirths, or we had babies that passed away, a week after them giving birth. So I was like, oh my God, why is this happening to me and why my family? So I think it was from then on that really sparked my interest in maternal and childcare health, because I wanted to figure out how can we prevent this from happening to anyone that comes after me, my family, and just the community back home in Nigeria. So I came back to America and kind of hit the grounds running and was doing and got involved in a lot of MCH work, which we won't get into today. But the one that I wanted to highlight the most that is near and dear to my heart is my work as a birth and postpartum doula. I absolutely love what I do, and the role kind of sort of fell into my lap. But for me, being able to support women during such a vulnerable time and such an intimate time in their life is something that I don't take for granted, and it's something that I really hold near and dear to my heart. So yeah, I love what I do as a doula, and it's really what sparked my interest in the work that I do today. After going to the hospital and doing some births with my clients and really having a lot of friction with the clinical team, it really opened my eyes to some of the challenges that we're having within the healthcare system. And that's kind of what invigorated me to go ahead and pursue a career in administration, because I wanted to be in a position where I could enact change and change at a larger scale. So I am very thankful to be in the role that I am in today. This is my 3rd week, so very new, but excited to be in this place today. So thank you.
No, that's really, really wonderful. Thanks for sharing your journey with us. And we'd love to delve into more around your experience as a doula. And I think a lot of people may be, not aware, but doulas in particular specific role as a doula goes all the way from prenatal and birth, and then postnatal care as well. So we'd love to hear about especially some of the more common misconceptions about women's health that you encounter as a doula in sort of that birth and postpartum work that you do.
Absolutely. I'm more than happy to share. Before I dive into the misconceptions, I want to set the stage and really make sure that everyone on the call understands exactly what a doula is and what our role is. So a doula is a trained professional that provides continuous physical, emotional, and informational support to our clients. So we do this before, we do this during, and after childbirth, right? And the whole goal around it is to really help our patients and our clients achieve the healthiest and most satisfying birth experience, while also preventing perinatal complications that may occur. So a lot of folks think that, doulas can catch the babies and, we don't have any medical training. It really is just that support and educational role that we play for our clients. So what exactly does that look like? We provide a lot of guidance, right, and really help them to navigate their health. We provide and utilize evidence-based education for prenatal, postpartum, childbirth, newborn, and infant care to really enforce what we're sharing and educating our patients and our clients with. We also provide lactation support. I provide lactation support and really helping mothers who really want to exclusive breastfeed really fulfill that and support them throughout their breastfeeding journey. We do a lot of work with their birth plans, really working with them prior to labor to develop, what do you want your birth to look like? Do you want an epidural? Do you want your baby to get that first bath or not? Like really making sure that we're cultivating a plan that resonates with who they are. And then also comfort measures. So we work with them to really develop or help them understand what comfort measures best work for them. So before you go into labor, you know exactly what positions work well for you to get through a contraction. I understand what makes you the most comfortable, so I can best support you during that process. But I think also a big part of that role as well is really the psychological and mental health support that we provide. I think just the ease, having that ease of care and having that one person who is there with you throughout your birth journey, that knows you in and out, that knows what your goals are, really alleviates a huge mental burden, right, from our patients. So having and being able to provide that space for my clients is something that I really enjoy as well. And then just connecting them to community-based resources as well. So that's kind of what the role of a doula is. It looks different for different doulas that you may connect with, but that's kind of how I approach it as well. And one thing about doulas I always love to highlight is all the amazing research that has come out around doula services on the effects of positive delivery outcomes. So a lot of research has shown that having a doula with you or having that birth doula really reduces your chances of a C-section, reduces the use of epidurals, reduces the length of labor, low birth weight, and premature deliveries, especially for people of color. So that is absolutely amazing. But even away from more of the clinical side of things, I think doulas really help their patients feel more empowered. They have a more successful and engaged and fun birthing process, and it really improves their succession, their breastfeeding success and duration. So that's a little bit about what doulas are. I love that the Department of Healthcare Services have now added doulas as part of their Medi-Cal benefits. I think people of color is the community that needs it the most. So knowing that they have that opportunity to get a doula, if they please, is absolutely mind-blowing to me. So I love that. And I think for me, the biggest misconception that I've seen in my role as a doula is that breastfeeding comes naturally. I think every single client that I connect with, I have the same conversation with them. I think mothers tend to think that once you give birth, it's a natural instinct for your milk supply to be at 100%. The baby will automatically latch on to the breast. But that is not always the case, right? While babies are born and have that reflex to kind of look for the mom's breast, it is totally normal and okay for mothers to need coaching and to need that extra support on how to position the baby, right? The position that works in the morning is not guaranteed to be the position that works in the evening time, right? So breastfeeding takes time, it takes practice, and new mothers, and I really try to empower my mothers that you're gonna get the hang of it and I'm here to support you. If this is what you want, we're gonna get it done. It's gonna take time, but don't feel down and don't feel like incapable, right, of not being able to do it. So I think that's the biggest one for me.
Yeah, no, absolutely, absolutely. No, thank you so much for sharing that wealth of information with us. There's so much in there that I think that the parents and expectant parents that are on today's program definitely would love to know, and I think definitely some important knowledge to impart to them. And you definitely cleared up some misconceptions and myths that I both believed in and were under the impression of as well. But yeah, I mean, look, I think with today's sort of evolving modern healthcare settings, you know, particularly with, you know, within obstetrics and of course the evolution of technology nowadays, we'd love to hear about sort of the evolution of your own role as a doula as well now, given the settings that we're moving into in the, you know, in the next era of healthcare.
Yeah, I think doulas have evolved so much. When I first started as a doula, I remember sometimes coming into the healthcare system or coming into the hospital and no one really knowing what I am and what I do, right? My client would bring me in and they're like, oh, I have a doula. And they're like, yeah, what is that? And what are we supposed to do, right? And a lot of folks would see us in a negative light, like, okay, stay in one corner and let me take care of the patient. You know what I mean? But I think now as doula services are evolving, as the research is coming out, everyone is starting to really understand what a doula is and how we are complementing the work that you're doing. We're here to support you. We're here to make your life easier, not make it difficult. And I think that as we're continuing to grow and people are starting to understand the role that we play, there's so much more that can happen with doula services. But one thing I will say, it is my ultimate goal to have doulas be a part of the healthcare team and be a part of the healthcare staffing in the hospital, right? That's not the current state of doulas right now. And I say this because one of the biggest things that we've learned from COVID-19 or one of the challenges from COVID is access to healthcare, right? I think more now than ever, we have an aging population and we have a sicker population. Folks are really starting to take ownership and get more involved in their health, right? And we're starting to see that there's a challenge of getting all these patients and clients in to the hospital, right? So we're seeing that we're having to kind of shorten some of our visit times, right? It used to be like 30 minutes before when I started. Now we're going to like 20, right? Because there's so many people that need care and that need these services, right? So when I think about providers and physicians really spending that time and going in depth and giving every single detail that moms may need to know about childbirth to empower them to feel prepared, they may not just have the time to do that because of all the clinical things that they have to get through, right? So this is where I see a doula stepping in. Imagine after seeing your provider, you then have conversations and build those relationships with doulas where they come in and really spend that time with you, teaching you everything you need to know, telling you about your nutrition and things that you should do to prepare for childbirth, right? I think one of the biggest challenges that I see and why people seek doula services is that educational component, because they really want to be informed and take the necessary steps that they need to take for a successful birth outcome. So I think that is one of my biggest goals, is to have this integrated here. We're working in partnership with our clinical teams. And then secondly, also having a setup where when a patient or mother comes in with a high-risk pregnancy, they're automatically getting assigned a doula, right? To support them throughout their pregnancy, to really eliminate or try to prevent any complications that may come during childbirth. So I think for me, that's kind of where I stand with it. If I can get some doulas in the hospital setting, I'd be a happy girl. But there's so much evolving and so much coming with doula, and I'm really excited.
Yeah, no, that's really, really awesome. I love the the fact that you really mentioned sort of the the different changes that sort of need to be addressed, and stuff in especially the day-to-day pieces that you're seeing. We'd love to hear about some of the key strategies you're currently also employing to address, especially the important disparities or the important need to address the disparities in the access to the quality maternal health care for all women of all backgrounds, especially those of diverse backgrounds. And are there any technological strategies that you also use within that?
Yeah, I think what I would highlight is a lot of this stuff is the basics, right? I think there's a lot that we need to do in setting the foundation and getting the basics correct. I think one of the things that I've seen and one of the things that we need to know is that people of color are already disenfranchised by the healthcare system, right? And that alone prevents them from coming in. That alone prevents them from coming to receive care. And I think what's most important, what I really try to focus on, is how am I creating a safe and comfortable environment for my patients to walk into and get the best care possible? How can I create an environment where they walk into, they will not be afraid of leaving without their baby. They will not be afraid of whether or not they're going to walk out of this building alive. How do I just make sure that we're creating that atmosphere for my patients? So I think that has been something that's been my biggest focus. What does that look like? Really making sure that we have physicians that look like them within practice, not just the physicians, but the clinical staffs, the RNs, lactation consultants, and the entire team, making sure that we have people that understand their backgrounds and have cultural competency where they can connect with them and understand and listen to their needs and their wants to really ensure that they have a successful birth. So I think that has been one of my biggest strategies, or really just focuses on just creating that environment where they feel safe to even come through the doors, right? And then really working on how do we continuously keep them engaged there on out. And I think it's also important to understand, especially in my community where I live, it's a very diverse community. People are coming from so many different places in California, and a lot of them have different traditional and cultural practices. Me as a Nigerian, I have thousands of cultural practices that we do right when it comes to birth. So how can we incorporate some of these things? How can we make sure that we're creating a space, right, where they can indulge and, do those traditional practices as well? So I think that's something that's really important. And then one thing I also wanted to highlight is mental health, because I know we're here to talk about that as well. And I think there's a lot that can be done with its from a technology standpoint, and that can be done early on during pregnancy as it relates to mental health. I think there's a lot of work already happening around assessing and screening for current mental health status, et cetera, and et cetera. But what I see as a challenge is that, yes, we screen, and I think a lot of people may screen just to check off a box that they screen the patient. But what we see as a huge gap is that follow-up and that provision of resources for our mothers and our patients. So I think for me, one thing that I'm starting to understand and starting to incorporate is that when we are screening for mental health, we're not just targeting mental health, but we're screening holistically, right? Looking at their social determinants of health, looking at their overall well-being, and really doing a holistic screening. Because what I've noticed is that when you're working with people of color and you're using words like depression, or you're using, diagnostic words, that can often turn them off, right? Because there's a stigma associated with some of these words. So how are you screening in a way where they will feel comfortable to express what's going on and express the challenges that they're experiencing at the time? So technology comes a huge play into this space, which is something that we're tapping into. But I'm excited to see where we go. But those are some of the things that I'm looking at and really being considerate of as I deploy and think through strategies to really support my people of color and just overall women's health.
No, that's really, really wonderful. So much information, like you just packed in such a short period of time. Everybody that wants a recap of that, obviously tune into the recording later on. We do put it on the YouTube, or reach out to Michelle. We put her LinkedIn in the chat and continue the conversation. I'm sure you've got much more to add, Michelle, and we're really appreciative of the information you'll be able to share and your insights and taking the time to come on the program today.
Absolutely. Thank you all so much for having me.